Bismillah ar-Rahman ar-Rahim. Our lecture today is about regional injuries. I'm Dr. Amal Saeed, Assistant Professor of Forensic Medicine and Clinical Toxicology, and I welcome you to this lecture. For today's ILOs, we are talking about injuries in different body regions, complications after injury in each body region, and the role of physician in regional injuries. Before we proceed to explaining injuries in each region of the body, we should have some basis or basic idea about injuries produced in any organ or in any region in the body. Any region of the body consists of certain anatomical layers. Every region of the body is surrounded by skin, and beneath this skin, this is subcutaneous tissue, muscles, bone, organs, blood vessels, and nerves. We should know what will occur to each of these layers when it is exposed to blunt trauma or sharp trauma. For blunt trauma, the skin may suffer from abrasions, bruises, or contused wound. And for muscles, there will be either contusion or laceration of the muscle. This depends according to the force of the trauma. If the force is less than the elasticity of the muscle will suffer from contusion, collection of blood inside the muscle. While if the force is more than the elasticity of the muscle, there will be muscle tearing and laceration. Blunt trauma to the bone will produce fracture. It may be fissure fracture or comminuted fracture according to the force of the trauma. In the viscera, the organs like the heart, the lungs, the liver, the kidneys, blunt trauma will produce either contusion or laceration and rupture, and again this occurs according to the force of the trauma. Blunt trauma to the blood vessels will cause crushing of the blood vessels or tearing, and to the nerves will also cause crushing or tearing. What about sharp trauma? Sharp trauma to the skin will produce either incised wound or stab wound according to the direction of the trauma. If the direction of the instrument is parallel to the skin, this will produce incised wound or cut wound. While if the direction of the instrument is perpendicular to the skin, this will produce stab wound. For the muscles, organs, blood vessels, and nerves, all these structures will suffer from cutting or stabbing. Cutting is the same as stabbing. The only difference is in cutting, the depth of the wound is shorter than its length on the skin, while in stabbing the wound is very deep. It has a track inside the body. For the organs, usually a sharp instrument which reaches organs, it causes a stab. Usually the organs are deep in the body, so if a wound reaches the organs, it is a deep wound. It is a stab wound, usually not an incised wound. Stab to any organ is penetrating, except for only one organ, which we will discuss later. Complications of wounds. We also want to say a hint about complications of wounds. We have 5 main complications which you studied in a separate lecture before. We have neurogenic shock. It may be either sympathetic or parasympathetic shock. We have hemorrhage causing hypovolemic shock. We have embolism, and in the embolism we have different types of embolism: air, fat, thromboembolism, and air embolism. is divided also into arterial and venous air embolism. We have crush syndrome, infection of the wound. Trauma to any body region may produce any of these complications, but of course, some complications are commoner in some body regions than the others, and some complications occur exclusively in a certain body region. We will see how this occurs with each body region. We will start with our first region. This is the neck region. Blunt trauma to the neck will produce injuries the same as we discussed in the first table. In the neck we have these layers. We have skin of the neck. Beneath the skin there is muscles, hyoid bone and cartilages. There is nerves and blood vessels. These are the injuries which may occur in cases of blunt trauma to the neck and sharp trauma to the neck. The only note here I want you to take care of that blunt trauma to the neck may occur due to asphyxia, may occur due to someone trying to asphyxiate, to kill someone by pressing his neck by a rope, by his hands. So the abrasions and contusions which will occur in these types of asphyxia will be very characteristic and will indicate the crime. Will, in case of throttling by the hand, pressure by the hands on the neck, we will have semilunar abrasions and discoid contusions. In case of rope around the neck, we will have abrasions and contusions which will take the same shape of the rope, and we call these the ligature mark. You will have a very good idea about this in the lecture of asphyxia. Sharp trauma to the neck may be cutthroat or stab wound, and the only difference here is that in stab trauma to the neck we have a deep wound, while in cutthroat we have a superficial or much less deeper wound. Complications of cutthroat include immediate and delayed complications. Immediate complications after cutthroat include neurogenic shock, and this usually occurs due to irritation of the carotid sinus, hemorrhage, and hemorrhage here is very severe because we have large vessels in the neck like the carotid and the jugular veins. Embolism in the neck occurs as venous air embolism, and the mechanism of this venous air embolism was discussed in the chapter of complications of injuries. It occurs due to cut jugular veins and the action of the platysma muscle fibers on the walls of the vein. Delayed complications include infection of the wound. Also, we have specific complications which are exclusive to the neck region. Asphyxia may occur in injury of the neck because we have here the airway going through the neck. Asphyxia may be immediate due to tracheal blocking by severe hemorrhage, or may be delayed for few hours and occur due to glottic edema, or may be delayed for few days, and in this case it occurs due to aspiration pneumonia. How aspiration pneumonia will occur? In case of trauma to the neck, especially cutthroat, few droplets of blood may go through the trachea. They are few drops, they cannot block the trachea, but they go deep into the lung tissue, causing irritation and causing inflammation and pneumonia. So we may have a question in the exam, give reason asphyxia may occur immediately or delayed after cutthroat. In this case, we should write these three mechanisms: asphyxia by severe bleeding blocking the trachea, delay for few hours, and asphyxia due to glottic edema, asphyxia after few days due to aspiration pneumonia. Now we are going to discuss chest injuries. For blunt trauma to the chest, here we have a table similar to that we discussed earlier. We have these layers in the chest. We have the chest wall, which consists of skin and muscles. We have the bone, the thoracic cage, consisting of the sternum and ribs. We have organs. These are the lungs and heart. We have blood vessel. This is the aorta. The blunt trauma will produce in each of these layers the injuries we said earlier. I want you only to have notice of these tips in the chest trauma. Blunt trauma to the thoracic cage may produce rib fracture. We have 3 types of rib fractures according to the mechanism of the fracture. We have direct force at site of impact. Here, when a person suffers an impact to the chest, we will have a fracture under the site of impact. Indirect force at posterior angle. Here we have a force which presses the whole chest, and in this case we have the fracture here in the posterior angle of the ribs. The red arrow here denotes the site of the angle of the ribs. This indirect type of trauma occurs usually in child abuse, when a child is held by the assailant and his chest is squeezed anteroposteriorly, so the force is distributed all over the rib, and so the weakest point of the rib is fractured. This is the posterior angle of the rib here beside the vertebra on each side of the vertebrae. We call this region the paravertebral gutter. So we have multiple fractures of the ribs in the paravertebral gutter, like in this picture. And when these fractures heal, they heal by callus formation. So we have multiple calluses above each other, as we see here in this X-ray of the chest. This is very pathognomonic for child abuse. The third mechanism of fractured ribs in the chest is flail chest. Flail chest is a variant of the direct impact. We have here a direct impact to the chest, and the fracture will be underneath this direct impact. Flail chest occurs usually in case of road traffic accidents. If a person is run over by a vehicle, like this, the wheel of the vehicle goes over the chest, it presses the chest, compresses the ribs, and so fracture occurs at both sides of the compressed area. This is the compressed area, and we have here fractures denoted here by the white lines. These fractures occur at the edges of the compressed area. So in flail chest, we have multiple fractured ribs under each other. They are multiple, 3 or more ribs. On one side, they may be on both sides. The problem here is the broken segments act independently of the thoracic cage. They are attached only to the thoracic cage by muscles and ligaments. So they act independent of the rest of the thoracic cage. In inspiration, the chest wall and the thoracic cage are expanded to the outside. There is negative intrathoracic pressure inside the chest. This negative pressure causes suction of the broken segments to the inside. So in inspiration, all the chest wall and thoracic cage is expanded outwards, while the broken segments are sucked inwards by the negative intrathoracic pressure. In expiration, the reverse occurs. Here, the chest wall and the thoracic cage collapses. The pressure inside the chest rises, causing expulsion, bulging of the broken segments outside. So you notice that the broken segments act on the reverse of or on the contrary of the rest of the thoracic cage. When the thoracic cage is expanded, they are inwards. When the thoracic cage is inward, they are outwards. We call this paradoxical respiration, and it is very characteristic to the condition of flared chest. Blunt trauma to the chest may also cause contusion of the lung and heart. This contusion may be coup or counter-coup. Coup means on the same side of the trauma. Counter-coup means on the opposite side to the trauma. So you have this year learned with us 3 organs which may suffer from coup and counter-coup injuries. These are the brain, the lungs, and the heart. The thoracic aorta may suffer from blunt trauma, causing its transection, its tearing. This usually occurs in cases of road traffic accidents. We call these acceleration-deceleration injuries. When the car stops suddenly by front impact, front accident, the body continues to go forwards, and the fixed and mobile parts of the aorta suffer from this forward movement, causing tearing of the aorta at the junction between the thoracic aorta and the descending aorta, like this. Sharp trauma to the chest. They follow the same rules we discussed earlier. There is nothing specific here, and I remind you that stab chest here may cause stab penetrating injuries to the lungs and hearts. You have known in the lecture of wounds that penetrating refers to penetration of the instrument of the weapon to a serous cavity. Complications of chest injuries include neurogenic shock, hemorrhage. Hemorrhage may be external to the outside or internal with blood collecting in the pleura and the pericardium, causing hemothorax and pericardial tamponade, cardiac tamponade. Embolism may occur. The type of embolism here, it is very important that you know the specific type of embolism for each body region after trauma. Embolism here is arterial air embolism. It occurs because an injury may connect a bronchus to a pulmonary vein, so the air goes from the bronchus into the pulmonary vein, then goes to the left atrium, and then to the left ventricle, and then to the aorta, and then to the other arteries branching from the aorta. We have also specific complications to the chest region. These are coronary thrombosis and pneumothorax. Pneumothorax is collection of air inside the pleural cavity, and the coronary thrombosis may occur from injury to the pericardium by direct trauma to the chest. Abdominal and pelvic injuries. The abdominal region consists of abdominal wall, this is the skin and muscles, and we have multiple organs inside the abdominal cavity. I want you to know that these organs may suffer from contusions, laceration, rupture, or avulsion, and I will discuss avulsion later. The abdominal wall will suffer, as we discussed, from abrasions, contusions, or contused wound. Here we have a very specific condition. The abdominal wall may suffer from trauma, but no injuries may be evident, especially contusions. We may have a trauma to the abdomen, but there is no contusion on the wall of the abdomen. This occurs due to the resilient muscles of the abdominal wall, which absorb the force of injury and transmit it into the abdominal contents. So be careful that the absence of injuries in the abdominal wall in a victim who claims that he was exposed to abdominal trauma doesn't exclude the presence of severe intra-abdominal injuries inside the organs. For the organs may suffer from contusions, laceration, and rupture, and we said this depends on the force of the trauma. And it may suffer from avulsion. What is avulsion? Avulsion occurs in organs which have a pedicle carrying blood supply, lymphatic supply, and nerves to the organ, like the kidney, like the spleen. In this case, rotation of the pedicle occurs, so the steering of the pedicle and the separation of the organ from its pedicle. Here we have a picture which explains clearly the difference between contusion in an organ, laceration, and avulsion. We can say that avulsion is tearing of the attachment of the pedicle to the organ. I want you to be very careful with the spleen and liver. We have a specific injury to the spleen and liver. Spleen and liver share common characteristics. They are highly vascular organs. They lie nearly in the same position in the abdomen, subdiaphragmatic, and they have a tough capsule which encloses them. When injury occurs to the spleen or liver, which is less in force than the elasticity of the capsule, there will be subcapsular tear in the tissues of the spleen or the liver, with accumulation of blood inside the organ under the intact capsule. If the bleeding continues, the organ will swell and the capsule will be stretched. And then the bleeding continues more, the organ is swollen more and more, and there is more stretching of the capsule. This process will continue until we reach the limit of the elasticity of the capsule. Here the capsule will rupture and the blood will go to the abdominal cavity, causing intraperitoneal hemorrhage. We call this hemoperitoneum. Collection of blood in the peritoneal cavity is called hemoperitoneum. The process we described takes time, so the bleeding is delayed. It may occur several days after trauma. So we may have a question in the exam: explain delayed intraperitoneal hemorrhage may occur after abdominal trauma. We must discuss and describe this mechanism. Sharp trauma to the abdomen. In the abdominal wall, we may have cut or stab wound according to what? According to the direction of the weapon. And we have stab wound to all these organs. Be careful that we said stab wound is nearly penetrating in all organs except in one organ, which is the kidney. The kidney is covered by the peritoneal membrane on its anterior surface only. It is not enclosed in peritoneum like all these organs. So when someone suffers from a sharp trauma, a stab to his back in the loin region, there is a stab of the kidney, but this stab doesn't penetrate the peritoneum. For complications of abdominal injuries, there may be neurogenic shock, there may be hemorrhage, and this hemorrhage may be external or internal. Internal hemorrhage means collection of blood in the peritoneum, and we said this is hemoperitoneum. Beware that this hemorrhage may be delayed, as we described in case of subcapsular tear of spleen or liver. We may have infection, and we have also some specific injuries. We have some specific injuries to the abdomen. These are intestinal gangrene, peritonitis, and paralytic ileus. Peritonitis means inflammation of the peritoneum, and it is a very serious complication. Paralytic ileus means absence of the peristaltic movement of the intestine, and this results in accumulation of the intestinal contents. Limb injuries. Limb injuries is very direct. We have these layers in the limb, and the injuries are like all injuries we discussed before. I want only to pay attention to this. We may have penetrating sharp trauma to the limbs. How penetrating trauma may occur in limb injuries? We have a synovial membrane in the limbs. This is the synovial membrane of the joints. Penetration of the synovial membrane of synovial joints is considered as a stab penetrating wound or a cut penetrating wound. Complications of limb injuries include neurogenic shock, hemorrhage, embolism, and the type of embolism here is fat or thromboembolism. We have crush syndrome, infection. Infection may be infection of the wound or in the form of bed sores, and hypostatic pneumonia. Both bed sores and hypostatic pneumonia are complications occurring due to long recumbency in bed after trauma to the limbs. Spinal injuries. Spinal injuries include vertical compression or excessive bending of the vertebral column. This occurs also in motor accidents, motor vehicle accidents, or dislocation, and it occurs in cases of judicial hanging. Injuries to the vertebrae include compression and the crushing of the vertebrae. The spinal cord may suffer from tear. This tear may be partial or complete, causing complete transection of the spinal cord. The role of physician. We have now reached nearly the end of our lecture. We will discuss the role of physician. The role of physician, as you are accustomed to, consists of something we must do and some things we must avoid. We must put the patient after abdominal trauma under observation because there may be subcapsular tear of the spleen and liver, and he may suffer later from delayed intraperitoneal hemorrhage. We must follow up the patient after the initial trauma for fear of delayed complications such as deep vein thrombosis and hypostatic pneumonia. We must avoid doing head tilt in any case with suspected cervical fracture. Cases of suspected cervical fracture include those falling from a height, those suffering from road traffic accident, if we have severe contusions in the neck. We must avoid head tilt because there may be fracture of vertebrae due to trauma, and the head tilt in this case will cause dislocation of the vertebrae and injury to the spinal cord. Now we reached the end of our lecture, and I thank you very much for your attention. Wishing you good luck.